Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today in the Kids Care series, I have Dr. Premila Naidu. To give you a brief introduction about Dr. Premila, Dr. Premila Naidu is the founder director of SmallBites, an exclusive dental care facility for children. Dr. Premila is a multifaceted personality who seamlessly assumes varied roles and responsibilities in life. She has over 20 years of experience in preventive and pediatric dentistry and has worked in renowned hospitals across Bangalore like the Fortis Hospital and the Narayana Hridayalaya. She has a bachelor's degree from the Oxford Dental College, Bangalore, and did her master's in pedodontics from the Oxford Dental College, Bangalore. Her passion for dentistry and her love for children drove her to start SmallBites, an exclusive dental care center for kids in the year 2007. Apart from dentistry, Dr. Naidu is a fitness enthusiast, and she also enjoys photography and biking. Dr. Premila, thank you so much for joining me in today's Tooth Talk conversation, and a warm welcome to you.
Thanks a lot, Dr. Rekha, and thanks a lot for that wonderful introduction too.
So I gather you're a biker, so maybe we should connect on that sometime.
Yes, we should.
So Dr. Premila, you are a pedodontist. That means a dentist who specializes in taking care of the oral health of children. So in 20 years of treating child patients, you have a vast experience in dealing with patients. I think considering, handling children requires a lot of patience. So what is the most common tooth problem that you would see among children these days?
Cavities, I think, Dr. Rekha. There are kids with lot of cavities, and lot of kids are having cavities. So if you see even the literature, tooth decay is the second most common disease seen in children. There is also numbers telling that for every 3 child, 2 of them can have cavities, so it is that common. And I think the problem becomes even more aggravated because during our time, I think we didn't have so many cavities, but our kids are prone for cavities,
Yes.
So it is still a very new concept for parents to accept kids can have cavities and they need to be sorted, especially in milk teeth. So yeah, cavities remain the most common issue. But then there is other things like, these cavities can cause pain, swelling, and, associated symptoms. That the other thing that we see is to do a lot with the alignment, habit breaking, and, jaw correction. So these are the varied things where a pediatric dentist usually comes to play a significant role. But yes, still, I think cavities are the most common problem that we see.
Okay, so if tooth decay is the most common problem among children, what would you say generally on an average a child would have how many teeth that are decayed in his mouth, say by the age of 6 or 7 years?
So
or maybe
milk
earlier,
teeth are,
even earlier maybe.
yeah, milk teeth are 20 in number, top 10, bottom 10. So the most rampant type of cavities are called as early childhood caries, in which the front 4 teeth, the incisors, get decayed. And sometimes in a child with 20 teeth, there can be a situation where, 12 to 13 of them have cavities. So might be in different stages, like the front teeth are more damaged or the molars are more damaged, but there are situations where more than 50% of the teeth in child's mouth are decayed. So yes, that's how it can go.
So if tooth decay is so prevalent among children, what according to you is the cause for this tooth decay? What causes this tooth decay? I think some parents think that it's a milk tooth, it will fall off, nothing's going to happen to that tooth. They probably don't pay as much attention. But according to you, since you have seen so many cases, what do you think is the most common cause for a tooth decay in a child?
So, Dr. Rekha, if we go by the theory, there is the bacteria which is responsible. So, there are two, Streptococcus mutant and Lactobacillus. Then the tooth itself, where the hygiene plays a significant role. Then the feeding habits. So, like I was telling you, the most rampant form of decays which are seen in children, very young children, that is before their first birthday, is called as early childhood caries. And there the feeding practices plays a very significant role. Like if the child is bottle fed, then what is added in the bottle? Is it sweetened or not? And if the child is breastfed also, especially after 1 year of age, though the breast milk is so rich in nutrition and it's helps the child with the immunity, the way the feeding is carried out, whether it's in the sleeping position and how frequently, and if the teeth are wiped after every feed or not, all this play a significant role in causing the cavities. Then we come to the sugar. We know sugar, of course, plays a very significant role with cavities, but
Cavities.
most commonly we have in mind that it is always only chocolates. Chocolates are considered to be the main
Sugar.
culprit, but sugar can come in different forms. Even if a child is on some syrups on a regular basis, they have sugar. There is a lot of hidden sugar in the syrups. Then there is your chocos, Oreo biscuits, chapati jam, anything that is sticky. Carbohydrate can be a
Yes.
cause for cavity. So we really have to look at the diet, hygiene, and the bacteria to make sure the cavity doesn't happen.
Okay, so that means to say a tooth decay is multifactorial. That means you cannot attribute it to just one thing. Probably the health of the tooth, the dietary habits, and the frequency of snacking, and how well the parents monitor the child's oral hygiene. They all come into play.
Correct.
Correct.
Absolutely.
So, Dr. Premila, what do you think is the best time for parents to get their children for a checkup, like the child's first dental checkup? When should it happen?
Earlier the better. Okay, 6 to any time after 6 months is supposed to ideal. 6 months when the child is supposedly going to get the first tooth, or when the child gets the first tooth, but it shouldn't be later than the first birthday. So if they've not visited till then, first birthday is a good time, because that's when we can see the earliest sign of early childhood caries. Like if there are, initial hypoplastic lesions, or the initial demineralization, if we need to find out about the feeding pattern and, counsel, understand, then that is the right time. And that is also the time when the cavity would not have been very invasive, and the child may not need too much of extensive treatment. It would mostly be preventive. So I
Yes.
think that is a very good age group. If we can see children that young, it would be nice to prevent cavities moving forward.
I think also what happens is when the child is brought into the dentist early on, I think the child familiarizes himself with the settings. It becomes much more comfortable for the child, when he comes for the subsequent sittings. And also
Yes.
counseling the parents becomes easier for us, so that we can tell them at which stage what they can expect in the child's mouth.
Correct.
Like
It plays a very important role seeing the child early.
early.
Earlier, I think we have this inherent fear of dentists. So we have to make sure, the kids don't have it, especially because we should not use that as a threat. If you don't brush, I'll take you to the dentist. If you don't do this, I'll take you to the dentist.
They'll give you
And
an
when we
injection.
see, yeah, the dentist will give injection, ho gaya fir to. So so we have to make sure that we see the child early. And you know what happens, Dr. Rekha, at this age, 1.5, 2, kids are scared of every medical professional possible, because they have been going to hospitals regularly for vaccination.
Visit.
So they
Yes.
associate all of us with that. So early, if we get introduced, and at that age mostly we wouldn't be doing anything, We just might apply fluoride or just do a thorough checkup, and that's about it. So there we can build a good relationship, which will help in long term, not only in treatment but even educating the child about brushing and all. If they've seen me for 1 or 2 years, when I talk
Yes.
to them at the third year and tell them,
Yes.
see, you have to brush,
Yes.
chances are there they may listen better.
Yes.
So
Yes.
that way the early intervention is very important.
Very important. Very important. So, but just in case for some reason, parents are not aware that they have to take their child early on, and they're probably waited, till the decay has developed. Whether, like you said, the feeding bottle caries that causes a lot of tooth decay in the front tooth, or for any other reason, all the back teeth also have become decayed. So, Dr. Premila, how do you think? Of course, parents can identify either the child complains of pain or food getting stuck and things like that. So, what would be the treatment options for any of this decay, whether it's a rampant caries or the other type of decay?
See, the treatment option, Dr. Rekha, will depend on the extent of the cavity. So if it is just the deep grooves which are just stained, but the cavity is not progressed, we can do something as simple as sealants, or just apply fluoride. So these all would come under preventive. So they are
So,
not therapeutic.
if I just ask, what exactly is a sealant, Dr. Pramila?
So, like I said, for the cavity to occur, the structure of tooth is equally important. So sometimes the structure itself is such that the grooves are quite deep. They tend to hold on to the food for a longer time. So sealant is when we put a material to make the groove self-cleansing. So it's a very short, simple, non-invasive procedure, but it has a lot of benefits and it's very useful, especially for the molars. So the treatment can be as simple as that, or if the cavity is just superficial, just started, on these grooves and pits and fissures, then we could just clean it and fill it up. And if the cavity is progressing deeper and deeper into the tooth, like if it's crossed the enamel, then it goes to dentine. And then if it's approaching the pulp, then we can do something called as pulp capping, where we put a medicated filling material so that the tooth gets a chance to heal. And if it's already touched the pulp or the nerves of the tooth, then we have to do pulp therapy, where there are different options like pulpotomy or pulpectomy, where we have to clean the root up and fill it up. It's also called as milk tooth root canal, but it's much simpler when done earlier.
Okay. Okay. So that means to say the treatment options varies from a simple fluoride application, which will be a preventive application, to a very simple non-invasive filling, which is called as putting a sealant, that is sealing off and ensuring that food doesn't remain there and cavity does not form there, to doing some very simple fillings, to probably like how in older people we do procedures like root canal treatment to treat infection. Probably the last stage, if there is too much of an infection, and there is swelling and pain in the child, probably that would be the thing.
Maybe you should not mention it, Doc. Most of the parents associate their root canal with the kids' root canal and are a bit apprehensive. So,
Okay. But I think an adult
no,
is
it is. Yes, but I think the fear comes with the duration. They wonder if their kid can keep the mouth as open and for that long a time. So yeah, so the pulpect is much simpler and a shorter duration. And kids do manage it quite well, though we as parents are scared how the child will do. They do handle it well.
Yeah, I think if the procedure is told to the child, explained and told that this is what I'll do, I think generally they understand, they are very smart that way. And most of the children are pretty cooperative, in fact, once they understand the procedure. Okay.
Mostly the fear is fear of the unknown. So once they start knowing what is going to happen, they are well prepared.
So I think that's where familiarization with the dentist starts. They come for routine checkups where nothing is done. They just meet the dentist. They meet the other staff, the other members, and they see others getting treatment done. It's like what we used to study and say, tell, show, do kind of a thing. Just make them a little more comfortable in that area, and then they understand what's happening kind of a thing.
Correct. That's why seeing them early plays such an important role than seeing them when they have pain or a swelling only, because by then the procedure might be invasive, and I don't want the child to associate me with only that.
Exactly.
So that's why.
Yeah. So, Dr. Premila, now what happens is, I think most parents would like to know, the kind of preventive measures they can take, to, since you said, some children can have up to 12, 13 teeth that are decayed. I mean, out of 20, 12, 13 is a huge number. That's more than 50% of the thing. So that means the
Okay.
chewing efficiency has come down, and a lot of other changes have happened for the child. So what, according to you, would be the preventive measures as parents they can take? What should they pay attention to?
Firstly, like I told you, let me look at the causes and then, put the preventive method along with it. Like first, I told you the cause is the bacteria. It could be the S mutant or the lactobacillus. So the first time this bacteria are transferred to the child, when the child just gets the first tooth or two teeth in the mouth, is from the caregiver or the mother. That's why we say the utensils and all, keep it separate for the children, and even kissing and all, we tell limited kind of a thing, because that's where they can get the bacteria from. Feeding habit, I cannot emphasize more on that. The bottle feeding and even breastfeeding after 1 year, or especially after the upper front teeth have come, it's always better to wipe the teeth after feed. And limit, yeah, and limit sugar or sticky carbohydrate. Brushing twice is very important. Once there are more number of once, if the number of teeth are just 2, 4, or around that, then they can use the finger brush, the silicone finger brush, which are gentle on the gums. As the number of teeth increases, they can move to a baby brush and mildly fluoridated paste. So oral hygiene is very, very important, especially for our children, and brushing twice has to be done. And as they become,
and this brushing, I think, has to be monitored by the parents till the child is, say, 7, 8 years, because I think
so we are talking about the age group where the parent should be brushing the child. Yeah, once they are even 6, 7, I would still recommend if the night brushing parents can do, because that's when the permanent molar come, and that's when the child wants to become independent also. And then we have this lot of permanent teeth having cavities. So supervised brushing has to be done. And I think early visit to a dentist again would play a very significant role in preventing caries. So we can identify whether the child is at a risk or know, or what's happening with his hygiene, and take things forward from there.
Okay, so that means there is a whole lot of responsibility on parents till the child is, say, 8, 9 years old, when it comes to dental health. So in a way, can you say that if the child has decay, the parents are responsible for it?
No, I think all of us together are responsible. We as dentists should be able to reach out to everyone and make them aware, like what you're doing, which is so wonderful. And why would a parent not want to sort it out? It's just that most of us are,
I think unconsciously, they, like you said earlier, everybody associates decay with sugar. So they are looking directly at sugars. They don't see the hidden sugars in the other food. So they are thinking probably it's safe and I'm giving it to my child. And they don't realize it's actually causing damage there.
Yes, yes. And another thing is about breastfeeding. Most of them know that bottle feeding can cause cavity. But, frequent breastfeeding in lying down position where the child sleeps off, drinking the milk is equally harmful. So there are few things that are, important to look at. So yes, caries is something, I think it's multifactorial, not only the way, but so many of us are involved in it.
Yes, yes, yes. I think that was, tooth decay is such a huge topic, whether it is in the milk tooth, whether it's in the milk tooth or in the permanent teeth. I think tooth decay itself is, I think it's almost like the entire dentistry is revolving around tooth decay.
True.
So,
that's true.
I think that was some information, hopefully, that our parents do understand about tooth decay in their child, and they understand and realize that a little taking their child a little earlier to the dentist probably goes a long way in preventing any future decay that can happen.
Correct. Correct. And decays are very common. So that is one thing that we as parents of present generation kids should realize. Like decays are very common. So earlier we identify, better it is.
Yes, yes. So again, the golden rule is visit your dentist regularly. Take your kids also to show him to the dentist just for a checkup. So that a lot of conditions that can be detected, especially during the growing phase in the child, probably can be rectified also. At that particular point, with proper intervention.
Correct.
Correct. Okay. So, Dr. Premila, that was a very interesting talk, and you did share your experience and information with our patients today. And I really hope it's helpful to them.
I hope to. I hope to. It's helpful to a lot of people out there. Thanks, Dr. Rekha, for having me.
Thank you. Thank you so much for joining me today. And I really hope I can get you back to talk with you about another topic about dental care in kids.
Sure, Doc. Anytime.
Thank you so much, Dr. Premila. Thank you so much for joining me today.
See you. Bye.
Viewers, that was Dr. Premila, who did talk to us and tell us about tooth decay in children, what causes tooth decay in a child, and how you can prevent tooth decay in your children. I hope that talk was helpful and you did learn some new things. If you have any doubts or queries, please don't hesitate to write to us and we will get back to you on that. So until next time that I come back with another topic to talk to you and tell you about your oral and dental health, keep smiling, stay safe and be happy. Thank you.